Good afternoon. My name is Amy McGlone, and this is a presentation on hip dysplasia in canines. The reason I chose this is because of this lovely creature right here. This is my German Shepherd mix. She is one of the breeds that is most commonly affected by hip dysplasia. Hip dysplasia is a condition in large breed dogs like the German Shepherd, the Golden Retriever, the Rottweiler, labs, where the coxofemoral joint or the hip joint is malformed. This is a common joint disease that can be brought on by excessive growth, too much exercise, nutrition, and certain hereditary factors. So the circled image here shows the deformed hip joint. So on the left is the normal hip, and you can see that it fits into the socket the way it's supposed to. In a hip dysplasia affected hip, the ball of the hip is malformed and doesn't fit into that joint the way it's supposed to. Hip dysplasia can be both chronic and acute. It just depends on the severity of the pain that the dog is in. So acute hip dysplasia presents as severe hip pain and severe lameness, whereas chronic hip dysplasia develops over a period of time and often results in arthritis in the hips. It is important to discuss hip dysplasia because of how common of a disease it is. It's not deadly or a misunderstood disease. It's just simply very common, and it affects large breeds mainly, but any breed can be affected. So, lameness is one of the most common clinical signs of hip dysplasia. Lameness comes in different severities, from no lameness to severe lameness that is more pronounced after exercise. Joint laxity, reduced range of motion, and pain during full extension or flexion may be present. A change in gait, often resulting in a bunny hopping gait, may present as well. Radiography is often utilized to determine the degree of arthritis and helps to determine the medical and surgical treatment plan. So on your screen, there is an example of what the x-ray might look like for an animal that presents with severe hip dysplasia. On the left is the affected hip, and as you can see in the circled area, how that joint does not fit into the socket because it is malformed. On the right, of course, you have what excellent hips or non-affected hips would look like under an x-ray. Treatments can be both medical and surgical. One surgical option is a triple pelvic ostomy, which is a procedure in which the pelvis of the dog is cut in 3 places to rotate the bone downward before locking it into place with metal rods. So that is a brief overview of what hip dysplasia is. If you're interested in learning more, feel free to check out the sources that I used in this presentation. I do appreciate your time and viewing of this presentation. Thank you so much.